Good evening to everyone. I hope you're all staying well and you're safe. Today, on our COVID Hammond perspectives, we have Joanna Frketich with us, a journalist with the Hamilton Spectator. And if you're familiar with the Hamilton Spectator, Joanna has been covering some of the COVID issues here in Hamilton, sometimes provincial as well, and so we're happy to have you join us and let us know how it's been um, for you covering COVID provincially, municipally, federally, and also what are some of the questions that you've had to ask yourself, and what's the toll that is had on you? We'll be talking about some of the stories that you covered, and yeah, if it's had an effect on you and how you see public health these days, because you've been covering these issues since 1999. So I'll do a quick introduction and then you can take it away. So we have Joanna Frketich from the Hamilton Spectator. Joanna has 20 years of experience on the beat covering hospitals, medical research, public health issues, long term care, home care, and she's been doing this with the Spectator since 1999. And now you can add that she's provided us with a good context of everything or some of the topics COVID in Hamilton. So, Joanna, can you share with us a little of your journey before we get into COVID?
Oh, sure. I've been in journalism for a long time. Since I was in high school, I actually started working in journalism as a high school co-op student at the Aurelia Packet and Times. I'm from Aurelia; it's a little cottage country city, and that was a 9,000 circulation paper. And I worked there right all the way through university. It was an amazing experience to learn about journalism in a small town. And I actually came to the Spectator first in 1998 and did an internship there before going to the St. Catharines Standard. And I worked at the St. Catharines Standard briefly before coming back to Hamilton. So I have a journalism degree from Ryerson University. And I love living in Hamilton. And I have a big Brady Bunch family. So lots of kids. So I'm a mom as well as a reporter.
Good. So you've been with the Spec for since what 1998, took a break, came back in 1999. Can you tell us in within those 20 years, how have you seen health issue and health issues and public health issues change?
Well, I have to say, a lot of it actually has been the same issues that I've been reporting year after year, in some cases, decade after decade. And covering COVID has actually almost felt like a culmination of 20 years on the health beat, as many of those issues have really come to the forefront during the pandemic. So, I've been writing about things like gaps in long-term care, the vulnerability of certain workers, particularly, say, personal support workers, hospital overcrowding, the way barriers to mental health care, and the Spectator has taken a very special interest in social determinants and how those affect your access to healthcare and your health. So we've been writing about those things for, I can't even tell you how many stories I've written about those things. And then during the pandemic, it's really shown the significance of those gaps and those inequities, and why those things need to be addressed, because they've really shown up in the pandemic, and in some cases in very devastating ways.
As a journalist, how do you balance providing information and you know and advocacy and change? Because if you are saying all of these things you covered and none of it has been addressed, or minimal stuff has been addressed. What do
Mhm.
you see is the role of journalists?
Well, I think the role of journalists is, to bring these issues to light and to keep bringing them to light, because, the more you write about them, the more people learn about them and know about them, and different organizations, sort of take up that cause. For example, the Spectator did Code Red. Steve Buse, investigative reporter Steve Buse, was the first to do the Code Red series that talked about social determinants of health, and that series really led to a lot of inner discussion. It hasn't nearly brought about, the change that you want to see at the very end. It's a very long journey, I think, but it has at least started the discussion and started to bring about some of that change and some thinking about those things. So as a journalist, I mean, that's what you do. You try and bring issues to light. You try and help people understand them. You keep going at them in different ways, writing about them through different perspectives, with the hope that, as you keep writing about it, as you keep providing that information and providing those different perspectives, that more and more groups, or more and more people in leadership positions, will start to understand these issues better and start to act on them.
So let's transition into COVID.
Mm-hmm.
Can you tell us where you were, and what you were thinking during March of 2020?
Well, my job completely changed on March 11, 2020. I went into the office as, a health reporter, long-term health reporter. One of the things I've always loved about the beat is that it's very wide-ranging. You get to cover something different almost every day, lots of variety. And I was about, midway through my day when all of a sudden I found myself racing to this press conference in Oakville, very unusual press conference, where it was announced that Hamilton and Halton had its first case of COVID-19. And since that press conference, I have pretty much written about COVID-19 exclusively every shift. And before that press conference, I did all different types of reporting. So I would do spot news, I would do, daily deadline reporting, I would do short feature, long feature investigations. During the last 15 months, I have pretty much written exclusively breaking news, every single shift, multiple stories, multiple versions of the stories, and going right to the of deadline. The big change for us at the Spectator is that I worked in a newsroom before the pandemic. And in a newsroom, it's really hard to put a newsroom into words. It's such a vibrant place. It's almost like a living thing a newsroom is. It's full of ideas and arguments and debates, and people are very passionate about the stories and the job. And, we all ended up, like many workplaces, at home, at our kitchens and our dining rooms and our home offices, very isolated from one another, and trying to keep that connection through Zoom or through Slack or through, different ways to communicate with each other. I have colleagues that I would consider friends, even though I've never met them in person, because they started at the Spectator after the pandemic. So if you had told me that, we would have a virtual newsroom that I would work out of before the pandemic started, I would have told you that that wouldn't even be possible. That's not possible in journalism. And so, it has been a massive change to how I do my job, and even what my job is every day.
So before we go into specific stories that you wrote, can you give us a general sense of how it's been for you covering COVID, writing COVID stories? Yeah, can you just tell us your overall, you
Sure.
know, yeah,
I think
experience?
the first part is just trying to keep up with it. So it's like an avalanche of stories all the time. It is so hard to try and make sure you get all of it covered. I'm often writing multiple stories a day and working on other stories, because you're trying to fit as many stories as you can in, because there's just far more stories than the team could possibly produce. The other thing with keeping up, COVID moves faster than any story I have ever covered. I have stories that have changed as I've written them. It's you're constantly trying to keep up with information. I read 3 newspapers that come to my house a day, but then I'm also, reading medical journals. I'm reading other news sources, trying to keep up with, the World Health Organization and Health Canada and all those things, just to try and keep on top of it. It's something that's very difficult to above and to understand that information. And then also you're just information out there as fast as you can. So, that's why I'm working to the wire of deadline every night, is to try and get the most up-to-date information into the paper and into those stories as I can each day. So, it's really like nothing I have ever covered before, in how fast it moves and how much information that there is. The other thing that is very difficult about COVID is that it can be harder than it should be to get information, especially good information around key metrics, around different issues. The numbers can be very difficult to understand because they'll sort of change without a lot of good information on why they're changing. Sometimes, city numbers won't match provincial numbers. You'll have the science table will come out with some stats or some suggestions, and that's different than what the province goes with. So it can be really hard to understand, things like how Hamilton's hotspots were determined when it comes to the postal codes, those 2 postal codes the province picked versus the 3 that the public health department picked. I'm even having trouble right now with Delta hotspots. Hamilton was left out as a Delta hotspot, which, to be fair, public health and infectious disease experts here have feel is reasonable. But I've had a very difficult time getting any sort of solid data that shows me how we are different in terms of Delta than the 7 other places, including Hamilton, that were chosen as hotspots. So that's the other thing, is that you're constantly sort of fighting for information, but not just fighting for information, but almost like wading through the information to try and find, what is reliable, where they came up with some of the information, how to get the information. Those are really probably the key thing when you're covering COVID is trying to get that reliable information and understand it.
So let's dig deeper into that before we move on to the stories. You say information, right? The public is always waiting for to read the newspaper to glean information. So if journalists can't find the right information, where does that leave the public? And I want to add another question there to say, you know, do you think that our institutions are responding adequately to the information that's needed? Because I found that with COVID, we haven't been able to get the required information to, one, make necessary decisions, and two, to provide the public uh, relevant information so that we are not stuck without knowing what to do.
Yes, it can be. Well, and the information is very confusing, because it depends on what site you're looking at. Ontario's COVID data has never matched Hamilton's COVID data when it comes to the Hamilton information that Ontario puts out. A lot of that has to do with time lags, or, well, as far as we can understand, it can be really tough to know why there are these differences, or even sometimes, it's how they calculate the information. So, for example, Hamilton changed this week how it determines the vaccination rate. So before it was using population estimates from 2021, and now it is using population estimates from 2020. And it's also including people who did not provide an address, who don't live in Hamilton, where before it wasn't. Now, it made these changes to line up with the province, but it shows you that, first of all, how they were calculating that number was different than how the province was calculating that number. But also, now that they've changed it, their numbers sort of took about a 2% jump. That gave them about a 2% boost by changing that. So it can be hard to know, how they come up with these numbers, or what is the right way. Is it better to go to the 2020 numbers as they've done, or would it have been better to stay with the 2021? It's really difficult to say. And so that's why part of our job my job as a journalist and our job as a newspaper is we try our best to go through that information, to explain the information, to explain how those vaccine rates are created, or why you're seeing some of those differences. We do our best to try and get to the bottom of that, so the public can understand, why they might be seeing some of those things. And then we also just try, I get questions from the public all the time. My big thing I'm working on this week is trying to help people find AstraZeneca and Moderna for their second doses. You do not know how difficult this is. I start out at public health, and public health hasn't even been able to tell me today how's the best way to get AstraZeneca and Hamilton. So then I just keep going, asking different people and going, so we try and find the information that the public is having difficulty getting. And sort of how we gauge that is through the correspondence that I get from people, from what I see on Twitter, from what I see on Facebook or other social media, or what we see in letters to the editor, any way that we can sort of engage with readers. And then from that, we try to take, what does it seem like people are having a really difficult time with? And then we try and either find the information or explain the information or get to the bottom of the information with varying levels of success, depending on what it is. But we don't give up. We keep trying even when we're having trouble getting the answer.
Yeah, I think getting the right information is always an issue. But um I want us to now turn our attention to one of the news stories that you contributed to, and I believe it was highlighted in the Canadian Association of Journalists, right?
Mm-hmm.
The House of Horrors,
Mm-hmm.
Roslyn retirement. Can you give us the context for how this story started, and what happened, and where you see things going, and what it did for public health, and can you give us the whole story? Excuse my my pun, but give us the whole story.
Well, that's a great example, the Roslyn Retirement Home and the House of Horrors, because that is one of those issues that I was talking about, where as a newspaper, we've been writing about those issues for years when it comes to gaps with seniors' homes. This one is particularly a retirement home versus long-term care, but some of those issues are similar, some are different, some are between long-term care and retirement homes. And it also deals with retirement home regulation. So Steve Buist, he's written extensively about the Martino family that owns that at that time owned the Roslyn Retirement Home. He'd done many series over many years about other homes that had issues and bankruptcy that had occurred with their long-term care homes. So, that is something that there had been issues raised many times about just seniors' homes in general and some of the issues that you see there, and then also with that particular ownership. And then you fast forward to the pandemic, where those issues have now become really acute. It really shines a spotlight on them. Like this was a home where was seeing a lot of the same problems that a lot of seniors' homes saw, that had really devastating effects, not good infection prevention and control, staff that were becoming ill themselves or scared to come in, and shortages of staff to begin with. And then by the time that home was evacuated, there were no staff from the Roslyn left, which is how, unfortunately, a resident was left behind in that evacuation. Because from my reporting, it was a very chaotic evacuation. There was nobody left there who knew anything about these residents or that home. It was, a hospital trying to evacuate that home. And my reporting was really focused on the hard news, spot news side of things. So it had to do with the evacuation, how that evacuation played out, the resident left behind, and changes to make sure that if homes are evacuated in the future, that they aren't left behind. But just the fact that you have a home that had to be evacuated in the pandemic because the outbreak became so acute there, it shows the issues in seniors' homes. And sadly, that was not the last time we had issues with COVID outbreaks in seniors' homes, though we, saw similar issues at Grace Villa and, other long-term care homes that had huge outbreaks. So that series looked both at the issues that you saw in the outbreak, but also it looked at a wider view of what that says about retirement home regulation. Katrina Clark wrote about whistleblowers and the lack of whistleblower protection, because the person who acted as a whistleblower when it came to that home had very serious repercussions as a result of that, did not get the kind of protection that maybe you'd like to see from someone who is raising very serious issues about a vulnerable population. I mean, these are very vulnerable residents in this home, and what that series showed through a number of different ways was, how they were really let down by regulation, by the ownership, by just the gaps that exist in seniors' homes in Ontario. And it covers a lot of different levels of government. It covers a lot of regulators and owners. So it's a story that I think really was one of the biggest stories of the pandemic, especially in the first and the second wave, when we really saw that seniors homes were among the most vulnerable and really became the epicenter of the pandemic. There was so much focus in the first wave on protecting hospitals, but really what was missed was that long-term care and retirement homes was the place that needed the protection.
Have we learned any lessons? Yeah, that's just as simple as that. Have we learned any lessons?
Well, it's hard to say, I mean, I would like to think that we've learned some lessons, but I mean, there wasn't any. We knew after the first wave that there were major problems in seniors' homes that made them extremely vulnerable to COVID. And instead of fixing that in the lull between the first and the second wave, or at least trying to shore up those homes or make them less vulnerable, instead, they were even hit harder in the second wave. And even now, while seniors' homes were not hit as hard in the third wave because, thankfully, of vaccination, there are still issues and gaps when it comes to information with seniors' homes. We don't have good information on vaccination on home by home, which is really important to understand, to know where the gaps are in vaccination and why you might be seeing that and what could be done to remove those barriers to help get those homes as safe as they could be. We've had the probe into long-term care that was done by the province, but did that probe go far enough? I think there's a lot more that could be done there and could be examined there. And then there's also the question of whether what has come out of that investigation will actually bring about changes. The provincial government has talked about some changes or brought in some changes, such as mandated hours of care, but those are things that will take years to put in place. So, I think the pandemic has been a big wake-up call about seniors' homes and about the vulnerabilities in seniors' homes. And, I would point out, this is not just the Conservative government that created those vulnerabilities in seniors' homes. Seniors' homes have been let down by, every government for years and years and years. This is a disaster that's many years in the making, not helped, by anything done currently, or during the first and second waves. So, will that lead to enough change? I think we're not there yet to know. It's definitely been a wake-up call, but will it bring about the change that's needed? It's hard to say. I mean, I predict that probably when I'm done writing breaking news every day, one of the first things that will be an investigative series for the Spectator is, what we've learned in seniors' homes during the pandemic, and whether those changes are taking place to try and keep that pressure up and to try and keep that spotlight on this very vulnerable area.
Yeah, 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 that was very troubling, and everybody that read it and saw it was just aghast, that
Mm-hmm.
how could this be happening, and it was happening across the province.
Mm-hmm.
Um, what, in your opinion, what other story have you written about or covered that you think was not covered enough during this pandemic?
Oh, well, without a doubt, I think who has been hit hardest by the pandemic. It took far, far too long to get any information around who was being hit hardest. It took months before we had any data that showed that racialized communities were seeing COVID rates at much higher levels, and that low income communities were seeing rates at much higher levels, and that combined, it was an even bigger disparity. To understand vaccination rates in hotspots, and what are the hotspots when it comes to which postal codes should be the hotspots, and how much attention should they get. It's been very hard to get that information, and I feel that is something that really needs a lot more investigation, to look at what is causing those disparities and what barriers are there and what needs to be done to change those barriers. I mean, at Board of Health yesterday, on Monday, there was an update. That's the first update I've seen in quite some time on these disparities. It found huge disparities. 45% of Hamilton's COVID cases are in racialized communities that make up 19% of the population. That is a massive disparity. And I don't think we understand those gaps well. And that information itself has huge gaps in it, because when public health was overwhelmed in the second wave, the first thing they stopped doing was collecting information that would tell them those disparities. And they made clear at the time that they didn't think there would be a way to get that information back. So these disparities could be even more than what we're seeing reported, because we know that there are a lot of gaps in the information that we're getting with that. So I definitely feel that is a story that has not been covered to the extent that it needs to be covered, that it needs a lot more investigation into why, into what needs to be done about that, into what barriers are there, and to how to start to minimize that gap, and start to try and understand that better, because COVID will not be the only place where you are going to see that disparity. I think that is not a COVID exclusive disparity. I think that is a disparity you would see with a lot of different areas of the healthcare system and a lot of different types of illness.
Yeah, yeah, I couldn't I couldn't agree more. HCCI and a number of health experts earlier on in the pandemic asked for them to collect that data, and I can only imagine if that data wasn't collected, where would be today. But
Mhm.
that's the topic for another discussion. I wanted you to, because you mentioned this a little bit. You wrote a story about Hamilton's contact tracing criticized by York researchers. Could
Mhm.
you, because I think contact tracing was one of the things that we didn't invest in to really get an understanding of how to address people that were contracting the disease. So, can you share with us what you found in that story and covering that topic?
Sure. Well, basically what happened was during the second wave, the public health department just became completely overwhelmed. There was just so many cases that, and it was very different than the first wave. So in the first wave, when there were cases, the people didn't have very many contacts because at the beginning of the pandemic, most of us, when they told us to stay home, we just stayed home. And, we all remember we thought that was only going to be for a couple of weeks or whatever. And then we'd go back to life as normal. But obviously, that didn't happen. And so by the second wave, when the second wave started shooting up, you have school kids who are in classrooms or maybe they were also on sports teams or they were seeing friends. And so they went from having case contacts of maybe a few case contacts to having dozens of case contacts per case. And the public health department just became completely overwhelmed. They did try to get some more help. The province sent them some help. The federal government sent them some help, but it was just an overwhelming workload. Plus, they have had a lot of difficulty hiring for these positions to try and up the amount of people they have working on this themselves, understandably, because everybody in Canada needs contact tracers. Every public health department is trying to get more contact tracers. So they were having trouble finding people. So one of their solutions was to change how they did that contact tracing. So it had to do with cases they felt were not as high risk. And so they would send them letters or they would send out a memo. They had different ways, or they would ask the person themselves to reach out to their contacts and tell their contacts. So it was sort of, I guess, when you just don't have the ability to do it anymore, they were just trying to find any way that they could reach out to these people. But what that York University study, that was based on research those York University researchers had done on how to control spread in a pandemic. And they found contact tracing was extremely important. And they felt that you really needed to reach out to people and talk to them person to person. A letter wasn't good enough. Asking someone to ask their contacts wasn't good enough. Like you, as the public health department, needed to actually get in contact with these people. And so that's what led to that story, because, that was when variants were starting to spread, much faster spreading variants. And there was a lot of concern that when you don't have good contact tracing, that makes it very difficult to control the pandemic. One thing the COVID-19 science table had made clear in its modeling was that with variants, contact tracing was going to be really crucial. So, I wanted to keep on that story when public health said that, they couldn't do that contact tracing for every case, because that was something that had been made clear by the science table as something that was so important to controlling the spread of variants. And so that was also around the same time that they stopped collecting that very important information on who was getting COVID, because for the same reasons of being overwhelmed and not being able to reach out to contacts. So that was partly where the information where it broke down, and not getting that information, which is really unfortunate, because at the time they said that they wouldn't be able to go back and get it again and fill those gaps.
Yeah, it's we we are in a huge conundrum, right? Because that people are working day in day out to do the best they can, but then at the same time, you know when things are not done in a way that addresses the needs of people are left behind. You know,
Mhm.
um, does this, and maybe I'm pushing you to an answer, but I think you are experienced enough to give us an answer here. You've covered public health for over 20 years. You've seen the impacts this pandemic has had on all health departments. Is it time to really start investing in public health and change how we talk about the social determinants of health and how it impacts public health departments, hospitals, and other areas of health?
Oh, absolutely. I mean, I think this pandemic has shown how crucial it is to have strong public health and to have strong investment in public health. I think people may not be aware that the Conservative government actually announced massive changes to public health, but right before the pandemic, that would take public health units in Ontario from 34 to 10 public health units, and also involved a massive decrease in funding to public health units and changing how public health units are funded. And those that restructuring has not actually been canceled. It's just been put on hold during the pandemic. Now, I mean, nobody knows for sure what the government is going to decide to do after the pandemic, whether they'll keep those changes exactly as they had envisioned them and announced them. But I mean, it's, it's pretty amazing to think that is, we could have gone through this pandemic with hugely decreased public health. I'm not really sure what the result of that has been when you see how crucial public health has been, and how over budget public health is when it comes to things to do with COVID. I also think that, there's been a lot of good delegations lately at Board of Health about how there needs to be more voices at the table, and how there needs to be more diverse voices at the table. I think that's brought about some good discussion, and that's something that maybe needs to be looked at, is some of those governance issues and how we bring some of those voices to the table to help bring in new ideas and to understand barriers, and to understand what's driving some of those social determinants, maybe looking at places like Toronto and Ottawa that have found a way to bring those voices to the table. So, I do think, this has shown that, there are huge disparities, and that there may be different ways that we need to look at those. I will say that I think when it comes to Hamilton's Public Health Department, I do want to say there are some things that they have been very transparent about. They were one of the first public health units to put workplace outbreaks up to make them public. Like, there were many public health units that refused to do that. So I don't want to give the impression that they have been, not transparent in any way, or that they've been, there have been some things that Hamilton's Public Health Unit has actually been lauded for provincially for being transparent. But then there are other ways, where it has been very difficult to get other types of information. There have been times where it's been very difficult to get other information that we feel is really important, or to get those answers in a timely way has sometimes been difficult. So, it's one of those things where I think there's a lot of room for improvement. There's, some things that they've done well, some things that, I think when the pandemic's done, it's a good chance to take a look at where we had gaps, and what we do to make sure that those gaps don't go forward. Because this pandemic, these things are not exclusive to the pandemic. These are issues that will continue to come up again and again when it comes to access to healthcare, access to preventative care, access to many different types of services. And we really need to look at this, because the pandemic, I think, is sort of the wake-up call, or the pandemic is really what shone the spotlight on why it is so important to try and address this, because it really showed, the really devastating disparity and inequity, and how very unequal this pandemic has been, in terms of who's become ill, who's been vaccinated, who has had access to testing. All of those things are just symptoms of a bigger problem. They're not exclusive to COVID-19.
Yes, definitely. And maybe before we move on to the next topic, can you mention maybe two other things that public health has done well? Because yes, I think others may listen and think uh, we're we always complain about public health. So maybe can you share good things that public health has done, so that everybody can know that public health is still doing work.
Well, I think it comes down to, they have made some attempts. They posted the vaccine rates for long-term care homes. They did do some initial work. Now, unfortunately, there was a lot of issues with those. Some of the homes felt they weren't accurate. They weren't able to keep it up to date. So, I think
Good news here. Good news.
so unfortunately, it didn't quite work out, but it did give us a first glimpse that showed, I think what was really valuable about that was it showed us that homes had hugely varying rates of vaccination, which is something we sort of expected to see, but that actually showed you that you can't just look at the overall rate of vaccination among staff. You have to look at what it is for each individual home and then try and understand maybe what the patterns are or the trends are. As I said, there was definitely the workplace that they made public, and then also even their current dashboard. There's a lot of information in that dashboard. Like there are attempts at being transparent in that dashboard, that try and give out some of that information, and they do change that dashboard depending on what reporters are asking for. So if I keep asking for a certain rate or a certain data point, often that will start to show up in their COVID dashboard. So I do think that they try to take what we are looking for and what we're asking about and get that out to the public. Would I like to have better data, have especially certain key data faster and easier to understand? Absolutely. I think there's huge room for improvement in data. COVID numbers have been, I can't even describe how difficult COVID numbers have been to work with during the pandemic. But, I do think there have been some attempts to make sure that information is out there. And COVID data is extremely important during the pandemic. It's not just that we want to know because, we're curious, we want to write scandalous stories or something. It's important because you need to make decisions about your health. So when, the premier says to you, I would like you to stay home, you need to stay, those are things that are very difficult for people to do. Those have huge trade-offs for your mental health, keeping your kids home from school, that has a massive impact on kids. Which, Kate McCullough at the Spectator has written about the huge impacts that McMaster University and McMaster Children's Hospital has seen as a result of the pandemic. So people need to have information so that when they are asked to stay home, or when they're asked to keep their kids home from school, or when they're asked to go get vaccinated, they have the information that they need to make informed decisions for themselves and to understand why we might be needing these things, and to also understand where they should advocate themselves, like where there needs to be improvement. It's hard to see where the gaps are if you don't have good information and can't see that and can't see some of the gaps or put together some trends. Then it's hard to advocate for change or hard to advocate for certain groups that are, if you don't know that COVID is hitting low income neighborhoods harder, then you don't know to fight for them. So when you have that information, then it can help mobilize the community and help the community be engaged and help them make choices for themselves, but also to see if there are ways that maybe they could help those around them.
Yeah. So we got some good news. Good work that public health is doing. Uh, so that's on record. That's good news. And then there's things that we could improve to provide information to the general public. Um, I wanted to switch to two more things. I think we're closing in on around 6 o'clock. Um, One huge thing that we saw people talking about before the pandemic, but even has also been increasing, is the opioid crisis. So, can you tell us or give us, a history of what's happening in Hamilton with the opioid crisis, and how you see it intersecting with the pandemic?
Well, the pandemic has just been devastating for the opioid crisis. Unfortunately, our public health measures that we have, they always have trade-offs. There's reasons that we do these public health measures, but they have trade-offs. And unfortunately, the opiate epidemic, the public health measures have just exacerbated what was already, a devastating issue. You have that, users are, when you're home, in your home, and you can't see other people, it just increases you using alone, and having nobody there, if you overdose, to help you, to call for help, to get that help that you need. There's been issues with outbreaks in shelters that have caused shelters to be closed down, or caused, I know the city has tried to create isolation spaces and help out with that as they can, but you just don't have, when you have the hospital and the healthcare system has had to postpone, temporarily halt many different programs. Some of those programs would be programs that people really with, people with mental health issues or people with addiction issues, that could have huge impacts for them, these postponements. So I really think that the opiate crisis, unfortunately, was already something that was of utmost importance before the pandemic, was something that, we already saw was devastating to our community, to many other communities around us, and devastating Canada. And the pandemic has only made that worse, and made getting help, I think, more difficult for people. And I think, unfortunately, we are just going to keep seeing that. I'm not really sure what the answer is at the moment to fix that, except to be able to make sure we start to bring back those programs, start to look at ways that we can, while the pandemic is ongoing, really have services that help out, that have services that will help to change this trajectory, because the pandemic has really, this is another area, one of those areas that we've been covering for years. Tevye Morrow at the Spectator has done a lot of work trying to bring as much transparency and bring things to light, and what is needed in Hamilton when it comes to the opioid crisis. And I think, especially this far into the pandemic, we need to find ways to really start to look at this issue, to put some more focus back on this issue again.
Yeah, and I think, as we mentioned earlier on, there needs to be more investments in public health, so that we can do the necessary preventative initiatives, so that we don't have all these huge incident responses, where the health outcomes of people um, are on the worst side, right? So we have to continue having that discussion. So, as a someone that covers health issues, there was one big health issue, and I don't know. You can correct me if I'm wrong. I don't know if it was covered. It was covered by the Spectator, and that had to do with MAID, medical assistants dying, and its impacts on people with visible and invisible disabilities. So, how, as someone that covers health, how do you ensure that some of the stories are stories that are uh, that are concerning for those that are historically marginalized, right? Uh, Hamilton has the highest density of people with disabilities. What are some of the stories that you have been writing, or that the spec has been covering, to ensure that we know about these issues?
Sorry, the issues about MAID, or the issues when it comes to those with disabilities and marginalization?
Both.
Both. Okay. So when it comes to MAID itself, MAID is something that I had on my agenda to do a bigger investigative piece on before the pandemic. Unfortunately, the pandemic has taken over my life, so I pretty much write exclusively about that. But the paper itself does, we've mostly covered MAID through individual stories, some very powerful individual stories mostly about people who've had issues with MAID, that MAID the way it is right now, it excludes them, or else they had a lot of difficulty getting that approval, and really looking at where things maybe need to be changed to make sure that people who should be covered by MAID are covered by MAID, or that it's easier for them. We've mostly told that through individual stories, although I do think there is room there for investigations. When it comes to trying to make sure that you cover marginalized communities or really any community, I mean, that's something I think every reporter and every newsroom is always struggling with. One of the things is that it would be great to see newsrooms be more diverse. I mean, I don't think it's a secret that newsrooms are not as diverse as they should be. And, I know that newspapers, including the Spectator, try to look at why that is and how that can change. But that's been a very slow process in changing that. And I also think it's trying to make connections with those communities, which has been which is difficult as newsrooms have less resources. I'm working on more stories a day. It's hard to kind of foster those connections, but I think that's something as journalists we need to look at ways that we can make sure we foster connections within those communities. And the pandemic has also made that more difficult, but I don't think that's a reason not to try and find those ways. The other thing that I would always tell people that I'm not sure people are aware is that it's actually very easy to reach journalists. My email is at the bottom of every single story that I write. I try to respond to every email that I get. And, I really encourage people that when they think we are not doing a good job, or that there are things that we are missing out on, or that we are missing altogether, or that we're really not covering the way we should be covering, I would, tell me that. I have a pretty thick skin. To be a journalist, you have to have a pretty thick skin. So I'm pretty fine with hearing from people telling me they don't think I'm doing a good job on something. And in fact, I think that's very important. And I also think people should remember that there's also op-ed pieces that you can write yourself, or letters to the editor that you can write to try and get your message out, or your viewpoint out that way as well. I mean, those things are more on the community, which I really those are ways that the community themselves can try and improve that. But I do recognize that as a newsroom and as journalists, we also have to find ways ourselves. We can't count on the community to come to us. We have to find ways to go to the community and tell those stories and find those stories.
Yeah. And building those trust, building that trust, working with various communities is important. And
Mm-hmm.
so yeah, we hope you continue. We have a question from Mike Belmore. What
Mm-hmm.
plans do you have for following the health hangover of COVID? Example, delayed surgeries, impacts of long COVID, mental health impacts, etc. Through the social determinants of health lens.
Well, I do think this issue is going to be, well, it already is one of the biggest issues in the pandemic right now. Many are calling it the fourth wave, or that mental health and delayed care will be a fourth wave of COVID. It's something that I don't think has had enough attention yet. We have had some coverage of it, but not nearly yet what it should be. And I do think it's going to exacerbate those barriers that you see. We already know through Code Red that somebody with that you're more likely to have a bad outcome, say with cancer, if you live in a code red neighborhood than if you live in a more affluent neighborhood. And I think those things are only going to be exacerbated when you have this huge backlog of care that, you're looking at something that could take months or possibly years for them to try and catch up on, and they have to find ways to prioritize those cases, and also to make sure that people feel comfortable engaging with the healthcare system again. And I think this is something that is going to be increasingly, especially as the third wave starts winding down, is something that our attention needs to turn to be able to look at that. Kate McCullough has started that work a little bit. She's done a lot of work on focusing on kids, so looking at eating disorders and mental health issues primarily. And I did a bit of work on surgeries, pediatric. Mostly it's been focused on pediatric, mostly because that's where the best data has been so far in locally. But I think that's something that is going to need to be looked at, obviously, citywide. And I think that's a good point to make sure that we keep that social determinants of health lens on that, and to look at how when you already had barriers accessing the system, when the system was running as it normally runs, how much worse is it going to be to try and access that system when it's hugely backlogged and you have so many people trying to access the system at once. So it's a very good point, and something that I think is going to be coming up next as the third wave comes to an end and the pandemic starts to hopefully turn into something very different than it is now.
Yeah, that's a great question, Mike. Thank you. Thank you for the question. So, um, this has been very engaging. It's good to talk to someone that has been covering health in the city for over 20 years. Um, and hopefully these health issues that we've talked about, lack of information, lack of funding, lack of good public health policy, all of that might happen in the coming months. Hopefully we'll work on it. But I just wanted to give you the last word before we sign off here. So any last words to those that are watching?
Well, I think what I would say is, as I've said, please reach out to us at the paper, any of us reporters. If there's something that you think that we should be writing about, I really want to hear from you, and I want to also hear from you if you don't think that we're doing a good job of that. And I also would like to, you can also reach out to me too, even if it's not feedback. I often take what stories I'm going to do or what questions I need to ask from the public. If I start to hear the same thing from a lot of people, I start to investigate that, or I'll know people are having a hard time getting AstraZeneca, so I better go figure out how they can get AstraZeneca. So, I want to make sure that people know we're very open to that, but also to reassure people that, we will keep fighting to get the information, to try and bring you the information that you need to make decisions as you're, trying to make very important decisions about how to start to engage with society again as Ontario starts to reopen, and whether you should get vaccinated and how you should get vaccinated, and when you get vaccinated, what you should get as your second dose. That's our job, to try and get you that information so you can make good informed decisions about yourself that will help you and will also help the community. And so we will keep doing that. And when we run up across barriers, we will keep, we don't give up when we, when they tell us no, that tends to tell us that maybe we should fight even harder for that information. So we will keep, we'll keep doing that. And we'll, and I'm also hoping that as the pandemic changes, we'll have the chance to do some of the investigative work that was a bit more difficult to do while the pandemic was in full swing and you're trying to keep up with a lot of stories. So, I'm hoping that what will come up next is sort of that chance to really dig into some of these issues and do some investigative work. I'm very eager to get back to that again.
Thank you very much. So we've been here since 5 o'clock talking to Joanna Frketich from the Hamilton Spectator. Joanna has been covering everything health since 1998. Took a break and came back to Hamilton. So if you need to get a hold of her, her email is underneath any of the stories that she's published in the last 20 years. You can get in touch with her. Thank you for those that tuned in and those that will watch this later on. We'll continue with our COVID ham on perspectives. We don't know who's next, or who will be talking to next, but we'll have one session again. So just stay in touch. You can follow us on Twitter, Facebook, Instagram. We'll put up a recording of this on our YouTube page. So just stay in touch with us. And if you have any questions too for us, you can always send us an email at info@hcci.ca. And the last piece of information I'll give to you is Restoration Clinic is back up and running Monday, Wednesday, and Saturday. So black, racialized, disabled folks, working folks, you can sign up. The URL is tinyurl.com/restoration house, the number one. And yes, any questions, info@hcci.ca. So thank you, Joanna, for joining us. And good luck to you. And we hope to read more interesting stories, informative stories. And yeah, we'll read up on all those stories. Thank you, and good night to you all.
Thanks for having me today.